just want to go over a little bit of the control panel with you guys. One thing that you want to do is you always want to get your request, all right, figure out what it is that you're going to do, okay, and then before you get your patient, you really need to make sure this stuff is all taken care of, okay. So the first thing I want to talk to you about is KVP, all right, and the way to do that is we're actually going to look at a technique chart, all right, and you want to look here for your KVP, and then I'm going to show you how to adjust that, and then here's your mass, and I'm going to show you how to adjust that, okay. So you've got KVP here. So let's say we're doing a digit, all right, the first digit, and it's 50 KVP, all right. So if you look there, that says 50. So that's going to show you how to adjust that, all right. And then this is your mass, and you want to have this button lit up because if you have that lit up, this is not going to give you the same thing. It's not going to really be your mass. Okay, so we'll flip that back on, and then let's say we're going to go up to 6.3 on the mass. So we would just hit that and go up to 6.3. Okay, does that make sense? Mm-hmm. All right, cool. So the next thing I want to talk to you about is the focal spot size. All right, if we're doing something like digits, you want to have a small focal spot, which is this right here. All right, it's the little boxes right there. If you're going to do something bigger, like a hip or a chest or something, then you have to go over to a large focal spot, okay, because you're using the grid, and I'm going to talk about that in just a second. All right, so there's our focal spot size, all right? So the next thing I want to talk about is the different kinds of grids. All right, if you see this here, this is our tabletop, like when we're doing our digits. All right, but then when we come over here, if we're going to do a hip, which we're going to do in the table bucky, you've got to select that grid. All right, and it shows the cassette being in the table. Now, next semester when we do chest x-rays, we're going to be going to the wall. So right here's your wall grid. So you're going to push that button to make sure that that grid's selected. All right? Any questions? Very cool. Thank you guys a little bit about the control panel and what different things to set on the control panel. You know, basically when you're working in the hospital, you're going to grab your request and you got to see what that is before you can come set this. All right? So before you get your patient, you want to have all your technical factors done and your control panel set, okay? I'm going to show you how to look at the technique chart, and the first thing that we're going to talk about is KVP, which is right here. All right? So then, don't worry about all this stuff right now. We're just going to talk about these things up here. All right, so here's our KVP. So if we do a PA, or sorry, actually it should be, PA patella, we're going to have 60 KVP. So you can do this a couple ways. You can actually dial it down, or you can arrow it down. Okay, there's your KVP. All right, and then the next thing you got to look at is your mass. Okay. Now, for this to be correct, you need to see this. All right. If that's lit up, it's going to give you a totally different readout. So make sure you see your mass. Okay. And again, you can dial it up or down, or you can arrow it up or down. So our mass for this is going to be 8. And of course, I would choose something that would take us a little while to get down. All right. So there's our mass. Okay. Does that make sense? All right, cool. All right, the next thing I want to show you guys is the focal spot size, because this is actually pretty important. If you're doing something small on the tabletop, like wrist or ankles or feet, you've got to set your focal spot size to being small. All right, it allows you to use lower KVP and lower mass, and it protects the tooth, basically, is what it does. Okay, so if we're doing a foot, well, 3.6 is 60 or 55, all right, or 58. You can use this small focal spot. Now, when you're doing something bigger, like you guys were just doing that Denelius Miller for the hip, you've got to have a large focal spot because you're using a gridded cassette on top of the table, so that light has to be off, and it allows you to use a lot more mass, like 25, 30, okay, so higher numbers. Plus, it also allows you to use a lot more KVP, okay? So I'm going to show you the grid stuff. All right, this button right here, when you push that, it brings you up 3 options, okay? This is tabletop, like if we're doing fingers and wrists and feet, anything on top of the table. All right, this is our table bucky, all right, which is what's showing there, and that means you're basically putting your cassette inside the table, okay? That's your table grid. And then here's your wall bucky grid, and again, it's just you're pulling that tray out, you stick your film in there, and that's your wall grid. And to get these to pop up, just push whatever one you need, okay? And to get these all to come back up, you hit that button, and then again, you go through and just do your selection.